It's an ICS transition, isn't it? So I thought the terms of reference sort of set out quite clearly how we engage, but don't have to be there all the time. But over to you.
Yeah, so this is an agreement across South Yorkshire and Bassetlaw, really from a practical point of view to help the CCGs transition into the ICB. And as you've just pointed out, so it gives a flexibility for Bassetlaw. We remain sort of a full member of the Joint Clinical Commissioning Committee and party to the subcommittee that might handle sort of joint decision making with regard to transition, but we don't always have to be there. So I thought it was important that we continue to have a presence. So this needs to be formally agreed by each governing body, because it means that we are delegating a greater range of decision making to the Joint Clinical Commissioning Committee as a consequence. There may be some issues that actually affect South Yorkshire beyond the 31st of March 2022. So those are the issues that we won't be taking part in, just to sort of clarify that about, you know, when are we involved in decisions and not. It's really those that are affecting next financial year and beyond that we won't be party to. So seeking governing body supports.
Anybody got any queries? In that case, is everybody happy to support this? Yeah, it's supported and approved.
Thank you.
And then the transition principles, this is verbal. I presume this is relating to Nottinghamshire.
It is indeed. We've actually got a transition update from Victoria, who's the SRO for this, later on in the agenda. And I wonder whether you wanted to combine the two things, because one will roll into the other. So.
Yeah. So do you want to wait till we get to Victoria's bit and then make sure we pick up these principles at that stage? Great, okie doke. So that takes us on to the public and patient involvement update, Sam. And we're on page 157, if it helps.
Thanks, Sue. Yeah, I think it was just to note that the chairs a meeting from the practice groups have recommenced. We thought it was timely, as Victoria wanted to do a piece of engagement with the Task and Finish group for transport on the mental health transformation, and they had some really good input into that meeting, Victoria. It was really well received, and also there was an update around primary care generally, and we will commence those meetings bi-monthly going forward. Victoria, did you want to add anything?
We can't hear you, Victoria.
Yeah, it was a really helpful, constructive conversation, and I do think they'll be helpful moving forward, Sam. I think engagement needs to be a key plank of our thinking about place-based arrangements in the future, and I do see that group as being kind of party to that. There are other mechanisms as well that we'll be developing, and I can update people on that in due course if you'd like me to.
Great, thank you.
Thank you. That takes us on to the audit committee update. As you can see, it's a fairly brief update. We did look at a couple of new areas, the one being the self-assessment against the new violence protection and reduction standards, and we also had Idris along to discuss the risks that he's responsible for and to look at whether there's any emerging risks that we hadn't got captured on the register, but there was nothing particularly that needed to be flagged with governing bodies, so unless anybody's got any questions. Great. So that then takes us on to the primary care committee update.
Thanks, Sue. This is a recent meeting from the 10th of September. I think topics are all what everybody's aware of and topical today around how busy primary care is. Key things being the flu vaccination programme up and running. Preparation was behind the scenes for the 12 to 15-year-olds and the booster campaign, which has now come to fruition again. So that, you know, really good planning so that can be up and running. Formal sign off of the incentive scheme with consideration of how busy primary care is and not to really make it too complicated and to make it, you know, fit for purpose, and really positive stuff around PCNs and the additional roles, reimbursement schemes and working together. Victoria, did you want to add anything?
Okay, Thanks for that. Not looking like anybody's got any questions, so that'll move us on back to Idris for verbal updates on COVID and flu.
Yeah, I'll do the COVID and a bit around vaccination. Victoria will probably come in and fill gaps. But on flu, I think probably Victoria, you're better placed to give you an update entirely on that. So just update governing body in terms of COVID more generally. We're still seeing very high rates within community. So Bassetlaw is on about 329 patients infected with COVID per 100,000. That's quite similar to Nottingham as a whole, 324. And it's a little bit higher than England as an average, which is 308. The highest is Mansfield at the moment in the Nottinghamshire region, which is 439. The vaccine's been very effective in terms of stopping people becoming very ill, stopping them entering into hospital, stopping them getting onto intensive care, and then ensuring that a very small minority unfortunately die. We've seen and are continuing to see small numbers of deaths though despite that, and that's just a factor of how high the prevalence is. Means that there is inevitably going to be some people who will fall quite seriously ill, even though they're a small percentage. We've just got 2 care home outbreaks at the moment, but we're not seeing the severity of illness that we did in the outbreaks prior to the vaccine. In terms of the vaccination programme itself, it has been, as you know, one of the most successful sort of programmes that we've seen, I think, from a healthcare point of view, led primarily by the PCNs. But I just wanted to highlight as well that there's still a fairly large proportion, about a quarter of patients who've received vaccine in Bassetlaw have actually accessed other vaccination sites than the PCNs. So the PCNs have done the vast majority, about 3/4, but there's areas such as Sheffield Arena that have done nearly 2,000 vaccines. So you can see that there is a bit of a spread there, and people do have sort of a number of choices. The uptake, particularly in the older age groups, has been phenomenally high, to be honest. So 86% of all adults now received the first dose, 80% have received the second. But even in younger people, it is higher than people, I think, who sometimes suggest. So the 18 to 29-year-olds is nearly 72% have had the first dose now, and the 16 to 17, nearly 2/3 have already had the first dose. So obviously they've been able to get the vaccine at a much later date, so you will see sort of those numbers slowly creep up. Men are slightly more reticent. According to the figures now, 77% of men have had the vaccine, 83% of women, so a bit higher. Our largest group that have not come forward so far is still the white other, predominantly Eastern European, where we're seeing vaccination rates of just short of 50%. So if you're a working class Eastern European origin male, then you're in the lowest group, but it's still sort of the majority overall that are obtaining the vaccine. And obviously you've heard now about the booster campaign and the campaign of extending the programme into young children as well, and that will be taken forward within the schools. So yeah, it's still very much with us, but the vaccine has, I think, stopped us having what would be, I think, a very, very difficult situation now. I think far higher than it would have been in the first wave had it not been for the vaccines. Victoria, do you want to add anything to it?
Just obviously, yeah, as you've mentioned, there's a bit of a challenge around boosters, but our PCNs are fully on board with that. I mean, our PCNs have just been amazing throughout the entire vaccination period, to be honest, and have really stepped up to the challenge on anything that's been thrown at them. So I think we absolutely need to recognise their continuing engagement and to do this. Just as a bit of a point of information around the the younger children, 12, 15-year-olds, we are working very closely with Notts Healthcare to deliver that now with the school service that they provide. They're working in concert with RDASH that provide flu vaccinations for that age group as well, school kids. So they're synchronising the delivery of both the COVID vaccinations and the flu vaccinations, because they're trying to keep them separate, although evidence suggests that they can be co-administered. We've got a schedule now for them to start in Bassetlaw schools very shortly. That's part of a programme across the whole of Nottinghamshire. There are 6 schools in Bassetlaw that are impacted and will be supported to go into schools and for the kids to receive the COVID vaccination. Obviously, some things we need to think about in respect to that are security and making sure that we don't have issues around anti-vax campaigners, which have been known now to be impacting where vaccinations are being delivered. So that's a concern for us, but we're working closely with the police service to make sure that we've got support if needed on that. So really good progress. The plan's in place. We'll be starting imminently, and hopefully we'll get good take up. Our plan is for 100%, but we recognise that could be very ambitious. If we compare it to flu vaccinations, we don't expect that really to materialise, but let's try and see how far we could go within the plans.
Thanks for that update. It's good that the hard work's continuing and it's having such a positive impact. So thanks for that. Flu.
Yeah, in a similar vein, really, the flu. The PCNs have all now got their plans in place, so they will be working hard to deliver the flu campaigns. And Deepti could come in and speak a bit more from a Newgate point of view if you wanted to, Deepti. But yeah, I think we've had some challenges around flu vaccination supply, that just now seem to be resolved or be resolving. We had a bit of a message for Larwood that we weren't going to get the supply when we wanted, and then it actually did turn up. So we're thinking that should be quite helpful. And there's a communication that came out, I think, yesterday to say that the delays that were anticipated, they will probably be able to mitigate. So people will be getting flu vaccinations quite soon. Again, the targets around this are very challenging, not what we performed last year. But I think we're up for it. We do know that we've ordered more flu vaccination this year to support increasing activity. But again, if the flu supply isn't delivered, that could be a risk to that. So yeah, we've got the plan in place. PCNs are up for it. I think Riverside's actually started doing their flu vaccinations last weekend. So the PCNs are starting to deliver them. I think the priority at the moment is going to care homes as well, and obviously supporting co-administration where we can with COVID vaccinations as well, to make efficient use of the resources that we've got. I think that's generally it. So we can provide a more detailed update because it's very early stages yet. We're not really into it, so there's not a lot of activity to report at this stage.
No, it sounds like all the preparatory work's been done, and hopefully it'll proceed as it usually does in an efficient way. So thanks for that. Not seeing any questions, so we'll move on to the emergency preparedness, resilience and response compliance assurance.
Yes, so we're required annually to give assurance to NHS England that we're fully compliant with their EPRR standards. We've had this at governing body every year for the last few years, so this is our latest version, and I'm suggesting that we support declaring full compliance against the standards. So if you're happy with that, that's fine. So short and sweet.
Anybody? Yep, everybody's happy with that. Because of the formatting, it covered a huge number of pages. So we're now moving on to page 290.
I had to complete it, Sue. So
for the counter fraud functional standards. And again, this is something that we've had reported before from the audit committee in terms of the standards coming out at the end of last year. What we're asking here is for governing bodies to formally delegate some of the responsibility in relation to these standards to the audit committee, and they're outlined. They're basically making the audit committee responsible for getting the assurance, evaluating the arrangements and making sure that the actions have been implemented. So if you're happy to approve that, that doesn't take away governing bodies' responsibility for oversight in this area, but just gives us a practical way of dealing with it. Not seeing anybody against that, so we'll take that as approved. And that takes us on to strategic objectives, and that's me again. Basically, the strategic objectives, we had an initial discussion on this and asked the execs to consider the addition of the one we discussed, which was around managing the close down of the CCG and transitioning to the ICB. That's now been drafted and basically brought back just for sign off by governing body to add to the existing 3 strategic objectives. Is everybody happy with the wording and how we do that? Great, thank you. So we'll take that as approved as well. And that takes us on to the annual assessment. Idris.
Yeah, just brief. We've had our annual assessment and now received the letter from jointly the ICS and NHS England, really. There is unfortunately no formal ranking of CCGs for last year. As you know, we've been rated as outstanding for 5 consecutive years. It does say in the letter, so I'm holding on to this, that had there been sort of formal ratings, I have no doubt we would have been outstanding for a 6th year. But other than that, it's just for governing body to note.
Great. Anybody got anything they want to ask? No, that's great. Thank you for that. That takes us on to our regular report on the governing body assurance framework and the risk registers. This is obviously scrutinised, the individual registers by the relevant committees and then the audit committee every time we meet. This is really just an update since you last had it, which is giving you an overview as of the position in September in terms of the split of risks over different types. Flags up the new risks that have come onto the agenda, onto the risk register since March. You'll see there are quite a few set out and what action's been taken to mitigate them. But I think given the level of change that's going on, you won't be surprised to see that quite a few of those are linked to transition and ensuring that things are protected as we move forward. There are a few IT risks linked to changes and making sure that we've got appropriate security around data, and also risks around ophthalmology at Doncaster that we've discussed before. So hopefully none of those came as a complete surprise to you. You'll have been aware of the issues, even if you've not seen the specific risks. Then we have the risks that are flagged as very high. Some of those are overlap in terms of the new risks that we've just talked about, but others you're already be aware of, the ones around the efficiency savings and community funding. So that shouldn't again have anything in there that you're not already aware of. As mentioned in the audit committee update, we've had Idris to the last audit committee and we had Hayley back in July. We've also looked at the risks register since March and archived quite a few old risks and things where we've actually managed to fully mitigate those risks and they've disappeared. So basically the recommendation is asking you to confirm that you're happy that the risk register and assurance framework represent the risks facing us and that you're assured that we're mitigating those appropriately. So if anybody's got any questions, or are you happy to accept those recommendations? Smashing. Thank you for that. And so that brings us, Victoria, back to the transition update. And if we can pick up on those transition principles at the same time, that'd be really helpful.
Shall I just kick off with the principles and then Victoria can talk to her paper? Yeah. And I'll try and be brief. So these were referred to in our conversation with Kathy earlier on. We have set out a proposal for 2 phases with the transition. The first leading up to the 1st of April next year, so putting everything in place to ensure a smooth transition. and then phase 2 being thereafter, which may result in sort of further changes, and I'm sure sort of it will to a greater or lesser extent. The reason just for distinguishing between the two is, as was mentioned earlier, we're not. This is the beginning of a journey from the 1st of April. It's not the end of the journey. So, what's important for us now is ensuring a smooth transition and ensuring that the foundations are in place for a strong Bassetlaw place for the future, with the collaborative working that we've worked out so successfully for many years now. And in that first phase, so leading up to the smooth transition, we've set out seven elements. So first of all, greater clarity for staff. So they've got the employment guarantee, but we want to ensure that that people know on an individual basis what that means for them. And we're hoping to be able to do that within the next few weeks. The second is the OD approach. Third is establishing the future with regard to the shared services that we currently hold with South Yorkshire and whether they will continue or not, and I think it will be a mix. Fourthly, the agreement between the two systems, South Yorkshire and the Nottingham and Nottinghamshire system, about how they will make decisions in the future, for example, that impacts on secondary care and a range of other issues. So I think that's going to be the next important document to be agreed, is the one between the two systems. Fifthly, what the place-based team will look like and how that will be managed. Sixthly, the change in region and the impact in that. And finally, the commitment with regard to patient choice and stability with regard to patient pathways, which are not expected or intended to change as a consequence of the Bassetlaw place move into the Nottinghamshire system. But I'll pass over to Victoria for the rest of her paper.
That's helpful. Thanks, Idris. But just before I do that, are there any questions at this point on those?
Oh,
So
yeah.
moving on to the paper then, as you know, we are all committed to making sure that we land this as well as we can do into the new arrangements. So in order to support us to do that, we recognise that we needed additional capacity. So we have commissioned an external resource to come in and support us doing that. That's a gentleman by the name of Mark Wall, who's coming in as a programme manager. How we've described the work that we need to do this transition phase is in 4 tranches in effect. We've got the close down of the Bassetlaw CCG as an entity, and there are 4 elements to that close down process. And this is in effect put in an Excel spreadsheet the specific tasks and requirements that NHS England are going to need to assess us against to make sure that we've closed down the organisation appropriately. And those 4 elements are around core due diligence, HR, financial and IT and assets. And there are SROs leading each one of those different themes, although individual members of the team will help support the delivery of specific tasks within each of those themes. A second key tranche of work is around the transition away from out of the existing arrangements in South Yorkshire. And Idris is leading on the vast majority of that. And again, part of the principles and the way of working across the 2 patches is part of that work as well. So Idris, Eric continue to engage really heavily in that transition conversation with our SY colleagues along various design and other groups, which keeps them very busy. The third tranche is around the place design and thinking about what are we moving into in a new space for the Bassetlaw place environment. And to that effect, a design group has been established and that meets every fortnight. And that's got key senior partner leaders from across our partners, including DBTH, PCN representative, the local authority, BCBS, for example. Notts County Council has also now joined that meeting. So that's really, really helpful. So those leaders are working through a set of questions which are around what are our ongoing priorities for next year? What kind of resources do we need to meet those priorities? The questions that we raised earlier that Hesh highlighted. How do we support transition and the shift and lift, as it were, of the majority of CCG staff into those place arrangements? And part of that work also needs to now develop into what's our communications and engagement strategy with our partners, as well as our staff, to make sure that everybody's kind of coming along the journey with us. And as you know, since the departure of Sarah, we've got a bit of a gap in our comms and engagement capacity at the moment. And just for your information, that rollout is out for advert now, with interviews planned for the end of next month. So the fourth tranche is then our engagement of the work into what we're moving into the Nottinghamshire patch. So Nottinghamshire ICS colleagues have now established a number of work streams that are listed within the paper, and they will cover a whole range of issues of how Nottinghamshire ICS wishes to move forward on those specific agendas. Some of them will be very much dealing with the immediate and the medium term. Some of them are thinking a bit more in advance. So, for example, the primary care strategy that was mentioned earlier in Kathy's discussion with us. Place model and the way that place works is a key work stream, for example, as part of how we're going to work forward. We're engaging in those now, those meetings are now in the diary. So it's still very early days for lots of these work streams engagement, but we are getting there. We've got SRO leads within the CCG nominated against each of those work streams. And part of Mark's job will be to make sure that, you know, those meetings are happening and what's the feedback, what can we learn as a corporate identity. To that end, we've got a task and finish group now established within the CCG. We are going to be meeting in a formal capacity every fortnight, in an informal capacity every fortnight, so every other week in effect. We've now set up some programme management architecture that will include a highlight report, a key issues, risks log, for example, and a communications plan. So we'll keep iterating them as we go through the next few months. What that group will also do, that internal task and finish group, is in effect also escalate risks and issues as we deem appropriate up to governing body, and also report into audit committee so we can keep audit committee fully abreast. And indeed, I've offered to attend the next audit committee, Sue, to give you that update and a proposal about how we start to develop committees in common for key committees, audit committee and remuneration committee for the last quarter as well. So that'll be discussion at the next audit committee. So we're progressing. We've got adverts out for, as I said, the resources that we're going to need to help move us forward, not least of which is the comms and engagement. We've also had very recent conversations with OD leads. Yesterday I had about developing our OD plan to support the transition arrangements. There are two key themes for me in the OD conversation. One is about working differently with our partner organisations in the new era in which we find ourselves, but also how do place-based staff also work differently in that new space. No longer seeing ourselves as CCG, but actually place-based resources to work on behalf of place. And there's a mindset shift there that we need to be thinking about and bringing our staff again on that journey with us. So I think that's the main bits and bobs. I can fill in any of the detail if you'd like me to, but I'll take questions at that point, Sue.
Thanks, Victoria. There's obviously a lot to do, and capacity begs the question how you're all coping and whether actually you think there's a risk that, you know, something might slip through because there's just a limit to what you can do.
Yeah, that is on the risk log, Sue. I think we still probably need to work through some of the mitigation of that, but that does include bringing people in, like Mark in. I think the other mitigation is that we've issued a tranche of job adverts for where we've got vacancies or impending vacancies again, so that we can make sure that we've got the full capacity of the team behind us to support us. So those are some of the key mitigating actions. But I think it's also recognising that, you know, we've got colleagues in South Yorkshire, we've got colleagues in Nottinghamshire who are also eager to support the transition process and help us as well, where we find ourselves in need of additional capacity and support. So that's a really positive environment to be taking this forward.
Thanks. Sam.
Thanks. Just an offer, Sue, and I'm sure you're the same. If you need any non-exec help, just give us a shout.
Thanks,
Yeah.
Sam.
And that has been very helpful, Sam. Thank you. Thank you, Sue.
Yeah, lot to do. We shall look forward to hearing how it progresses and help where we can. that brings us to the end of the public agenda. The next meeting is on the 16th of November, again via Teams, unless anybody's got any other business, which I forgot to ask about. Idris.
Victoria's jumped in as well, so I'll let Victoria do the one I think she's about to do.
Okay.
But I was just going to mention that obviously we normally have our annual general meeting in September, and that's pre-COVID times. You would have been in public, usually using the well. Obviously, we're not doing that this year due to social distancing and still the high rates, which we didn't want to contribute to. But there will be an online AGM presentation from Hayley, Eric, myself and Nicola, covering all of the issues that we would normally have brought up in the AGM. And obviously there's the full annual report that's also online, but that will be made publicly available within the next week.
So you're just doing it as a sort of recorded thing rather than a live online event?
Yeah.
Victoria.
So my apologies, Sue, if I've missed this, so please forgive me, but have we actually formally considered and approved the strategy paper from the JCCG? The manual agreement in terms of reference? Have I, sorry, did I miss that when I returned?
We did do that, yes.
Okay, sorry.
Sorry, no, we're all right.
Well, we formally...
That bit.
Sorry, my apologies, I just want to make sure.
Yeah,
Thank you.
We were fairly brief on the item, Victoria. So.
Okay.
Nobody had any questions, but we thought it was useful that it gave that flexibility for us to be involved in the things we needed to, but actually opt out of the things that actually aren't really relevant to us going forward.
No, that's fine, that's absolutely fine, thank you.
No, you're fine. So with that, you've got the items for information. So unless anybody's got any questions on those, we'll close the public session and move straight into confidential. So Lindsay, can you stop? Oh, sorry, we've got a hand up. Kumar.
Hi, that's okay. So I'll touch in the confidential session. Thank you.
You sure?
Yeah.
Okay.
Can I just mention something else for the record, Sue?
Yeah.
As people will recall, we discussed the mental health strategy and the mental health beds engagement process and the feedback that we had from the Health Scrutiny Committee as well. And I've subsequently attended another Health Scrutiny Committee meeting, so I'll give a sort of full update separately from this meeting about that. But it's just really to note formally that we will be bringing back the proposed transport sort of arrangements as requested by governing body in the next governing body meeting, and we'll also be taking the same to the Health Scrutiny Committee, so it's just formal. So a very brief update on that as it's progressing. That's
a useful and important update. Thanks for that, Idris. Right, with that, we'll now move into confidential. So